So we are looking at prolonged obstructed labor. Prolonged obstructed labor. So prolonged obstructed labor is an issue that could come up, okay, when a woman is meant to like give birth, but she doesn't like give birth at the time that is meant to. So prolonged obstructed labor, so that is a serious complication during childbirth where the baby cannot progress through the birth canal despite having there are a lot of uterine contractions but the baby cannot actually progress, okay, and be delivered. So if the labor is lasting more than 20 hours, okay, in a first time mother, or 14 hours in the woman that has given birth before, we say that the labor is prolonged. Obstructed, there is something physically stopping the baby from progressing through, okay, while prolonged labor can also be physiologic, like things are not getting relaxed for the baby to come through and all of that. So it can be both physical and physiological, right? So a lot of things that could make the labor prolonged or obstructed is cephalopelvic disproportion. So if the head of the baby is too big than the pelvis, right? So malpresentation, the baby is not presenting with the head. So shoulder presentation, presenting with the buttocks, okay, so all those malpresentations. The pelvic abnormalities, the mother has some abnormalities. Soft tissue obstructions, so all of these could be issues, okay. Then clinical signs, there's failure of the labor to progress despite a lot of contractions coming in. You can see the Bandel's ring, you can see distended lower uterine segment. Then the mother is tired, is dehydrated, the baby is distressed, or death can even set in, okay. So management is you have to early on dictate it from that monitoring of labor you are doing on the pathograph. Then you can resuscitate using intravenous fluid, oxygens, or correction of electrolytes. So delivery, if it is too long, you mustn't try vaginal delivery, right? You can actually just go in for cesarean section, or sometimes use instrumental deliveries, okay. Then all of that. So prevention, you have to actually pick up those risks of a woman having prolonged delivery or so right from antenatal, okay. Then you apply all the skill birth attendants. Then you are using pathograph throughout labor so that you are seeing if the graph is tilting towards any abnormalities that will come up.